Depression.
Depression.
Depression. Depression is like hell on earth. It's dark, lonely, and very selfish. The feeling of not wanting to live, but not wanting to die. I can't get going and feel like I can't do anything. Feeling sad all the time.
Not feeling like you can talk to anyone.
Wanting more than anything for this feeling to go away.
Feeling like all of your energy has been sucked out of you.
Feeling frustrated and annoyed with yourself for not being able to shake this feeling. My name's Barinda and I suffer from depression.
My name's Aman and I've suffered from depression.
My name's Simran and I've suffered from depression.
My name's Gagandeep and I've suffered from depression.
Hi, I'm Dr. Gill and I'm going to talk to you today about depression.
What is depression?
We often say we feel depressed when we're feeling down, which is normal. Usually the feeling passes quite quickly, but sometimes it stays and doesn't go away and begins to interfere with your life. This is what we call depression. Medically, it has to last over 2 weeks and has the following 3 features. Low mood, low energy called anergia, and little interest or pleasure in doing things, which is called anhedonia.
Am I the only person who is suffering from this?
No, not at all. It affects over 2.3 million people at any one time in the UK, and up to 50% of cases go undiagnosed. Ethnic minorities such as the Asian community are much less likely to seek help.
What are the other symptoms of depression?
Other symptoms a depressed person may have are to do with your feelings, so you may feel restless and agitated, very tearful, and unusually irritable or impatient. You may feel like the future is hopeless. You can have symptoms to do with your behaviour, like not wanting to go out and socialise, cutting yourself off from your friends and family, and it may even progress to self-harming. Your thoughts may be affected, so you may have difficulty remembering things, you may have difficulty concentrating or even making decisions, you may lose your self-confidence and self-esteem. You may also think very negatively about things which may not be your usual way of thinking. Also, it is common to have physical symptoms like difficulty falling asleep or waking up very early in the morning, feeling very tired and low in energy. Some people lose their appetite, some people want to eat more. You may have physical aches and pains which have no obvious physical cause.
What can I do to help myself?
Depending on the severity of the depression, there are different treatment options available. For mild depression, the first thing we tend to do is wait and see. This is where we have a set time period where we monitor your progress to see if symptoms get better themselves. Another option is exercise. There is a lot of evidence that exercise not only increases your energy levels but helps release happy hormones in your brain which make you feel better. For mild depression, there is the option of self-help groups. These are specially designed small groups that are safe and confidential where you discuss your feelings to help each other. These groups are based on CBT, which is cognitive behavioural therapy. For mild to moderate depression, the main form of treatment would be a talking therapy. These can be based again on CBT or more traditional counselling. Normally it is your GP that refers you for this treatment, but you can self-refer or find a counsellor privately. Another very easy and effective way of helping yourself is use self-help websites where you log in and go through the steps, which are based usually on CBT, and they offer a free and effective way of being able to take depression into your own hands and help yourself. For severe depression, the main form of treatment is antidepressants. Antidepressants are prescribed by your GP, and they would look into different factors to see which is the best medication for you. Also, sometimes combination therapy is used. This is where you have antidepressants combined with a talking therapy. There is no quick fix to depression. There is no one tablet that will make you feel better. It's about addressing underlying issues and helping yourself feel better, working through the issues that may have brought the depression on, or changing your own life circumstances so that you feel better about things.
Why is it important to get help?
It is important to seek help if you or somebody you know is suffering with depression. Sometimes depression can be brought on by other factors. For example, there may be deficiencies in your blood, like anemia or vitamin D deficiency. There may be underlying issues with your thyroid gland or your cortisol levels. These can all be tested by a simple blood test. If you're on other medication, then it is important to check that the depression is not a side effect of that medication. Left untreated, depression can get worse. There's an increased risk of self-harm, suicide, and in severe depression, it can lead to psychosis.
Where can I go for more help and advice?